The next speaker today is also visiting Tromsø and our center today. Ingjerd Skafle is a PhD fellow at Østfold University College. She has a master's in special pedagogy and her research interest lies in autism and social media. So we look forward to your presentation on misinformation about COVID-19 vaccines in social media. The floor is yours.
Thank you. Hello, so I'm excited to be here and be invited. Yes, so my name is Ingjerd Skafle. I am a doctoral research fellow at Østfold University College, but I'm also affiliated with the Faculty of Medicine at the University in Oslo, so that's where I'm enrolled in my PhD. Yeah, so the topic or the study I'm going to talk about today is part of my PhD project about how social media shapes our perception of autism. So yes, this particular study is called Misinformation about COVID-19 vaccines on social media, and it is a rapid review, which means that it's a literature review where we go through previous studies. Yes. And one of the presentations earlier today talked about the benefits of social media and how you can promote vaccines. So I'm going to have the sort of opposite take on it and talk about misinformation. So just very briefly, the study design, we followed the guidance from the Cochrane Rapid Reviews, and the narrative qualitative synthesis was undertaken with the guidance of PRISMA, and the synthesis without meta-analysis, or abbreviated for SWIM. And below you can see the reference to the article that, because the study is now a published article in the Journal of Medical Internet Research, or JMIR it's called, so I just screenshot the article there. Yes. So this study was done in collaboration with 4 other people. And the research team, I want to just briefly mention them. The first is Anders Nordahl Hansen, and he is a professor at Østfold University College. And the second is Elia Gabaran, who is an associate professor at Østfold University College, and she also works here at the Norwegian Centre for e-health research as a senior researcher. And then we also collaborated with Daniel S. Quintana, who's a professor at the University of Oslo, and also Rolf Wind, who's a professor at and he's affiliated with the Arctic University of Norway and the University Hospital of North Norway. And his picture with the beautiful city of Tromsø in the background. Okay, so the background for this study is that during the COVID-19 pandemic, there was a massive global effort to develop vaccines. And it was really remarkable how the health authorities worldwide came together and really managed to create these vaccines, which also halted the whole pandemic. However, what became increasingly apparent was that in some of these, especially high-income countries where vaccines are available and free, there was a drop in vaccine uptake and an increase in vaccine hesitancy. And the reasons behind that are many and complex. And of course, with the pace of the vaccine development made some people skeptical about these vaccines, which is understandable. But we also saw a very massive amount of information on social media platforms, to the extent that the WHO coined the phrase infodemic, which means too much information, both correct but also misinformation on social media platforms and also in physical environments. And another important backdrop for this study is the story of the MMR vaccine and autism, because in 1998 there was a study that linked the MMR vaccine, which is short for measles, mumps, and rubella vaccine, linked this vaccine to autism, which of course caused a lot of chaos. It has later been retracted, but the false rumor lingers in social media, and it has also spread to other types of vaccines, that vaccines can cause autism. Okay, so the objective of this study is first to synthesize the existing research on misinformation about COVID-19 vaccines spread on social media platforms and its effects. But the second aim was to gain insight and gather knowledge about whether misinformation about autism and COVID-19 vaccines was being spread on social media platforms. And the method we used, we performed a literature search on the 9th of September in 2021. And we searched several databases such as PubMed, PsycInfo, ERIC, Embase, Cochrane Library, and the Cochrane COVID-19 Study Register. And we included publications in peer-reviewed journals that fulfill the following criteria: original empirical studies, studies that assess social media misinformation, and studies about COVID-19 vaccines. And we used a thematic analysis to identify the patterns or themes of misinformation. And in order to assess the risk of bias, we used a tool called, developed by Joanna Briggs Institute Critical Appraisal Tool. And the ratings of the certainty of evidence was done with the help of recommendations by grade. So the results, we found 757 records, but ended up with 45 studies that were included in the review. And the 45 studies were sort of split in half, like half of them had the design of surveys or qualitative interviews, whereas the second half gathered data from social media. And we summarized which social media platforms that were most studied. And some studies didn't mention the social media platform, they just talked about social media platforms in general. But here's the summary of the ones that did. And you can see Twitter is by far the most studied platform, and followed by Facebook, YouTube, and Instagram. So you see there are several platforms that are sort of understudied, which I'll come back to. And through the thematic analysis, which is a qualitative approach, we found three themes of misinformation. And they're all kind of intertwined, but we found it also beneficial to look at them in separate ways. So the first were conspiracy claims. Some of them are infamous, about microchips, 5G, secret societies, and hidden power structures that aim to depopulate countries or cultures, or or even that COVID-19 was man-made to enforce vaccination. And then there was a theme called medical information, which has to do with sort of anything that, what will the vaccine do to you? It can cause infertility, chronic illness, physical deformities, or that it will cause COVID-19 in itself. And also there were misinformation about the development of the vaccines, where you have a lot of different things that was said about the content, and that crucial steps were skipped in the development because it had to happen so fast. And the result of the effects of misinformation. So out of the 45 studies, 19 studies talked or made assumptions regarding the effects of social media misinformation. And basically they talked about vaccine hesitancy. and being less willing to have the vaccine because of the misinformation they have come across on social media. However, there were only 2 of these studies who had a higher certainty of evidence, and they had a more experimental design. So it's kind of hard to assess the effect, but these studies at least made assumptions and discussed this issue. Okay, so as I mentioned, there were 3 types of misinformation. Some are quite well known and infamous. We discussed whether perhaps the medical misinformation can create quite a lot of harm, because we know from before that people were hesitant, not necessarily unwilling to have the vaccine, but hesitant because of medical side effects, which is very understandable. And the type of, meaning that when you then read medical misinformation, perhaps this will be a very easy to be scared of these types of misinformation, whereas the more obscure types of conspiracy claims is perhaps, I don't know, for a certain type of people who are already into that conspiracy world. So that was one thing we discussed in the article. And also the social media platforms. Twitter was by far the most studied platform. And because they have opened up for researchers to study what's going on their platform. What's going on now with Elon Musk, we don't know, but that was how it was, at least. So definitely more social media platforms need to be investigated. And especially we know that TikTok is really on the rise among young people. So it's a very important platform to study. Another important thing to be aware of is the historical background and cultural awareness when we discuss a complex issue such as vaccine hesitancy, because maybe one of the key takeaways from the study is we don't think it was beneficial to sort of mock people who are vaccine hesitant. There are profound reasons also to be hesitant at one point, but it doesn't mean that you're unwilling to have the vaccine. But to understand that in different countries and in different cultures, vaccines might have a very completely different background from where you're coming from yourself. And some, for example, studies mentioned a really awful study in the US where the US government experimented with African-American people in a syphilis studies where they denied them treatment to see how it played out. So these are things to be aware of when you discuss vaccine hesitancy and the trust in actually health officials. It's not that easy in all countries or cultures. Also the effect of misinformation. As I mentioned, of the 19 studies, they made assumptions, but it's not that there were not 2 of the studies that tried to measure an effect and had an experimental design. And also the effect was to the most part to be vaccine hesitant after reading misinformation. But a lot of the studies also show that the social media platforms managed to stop some of this misinformation to spread. For example, a study with where the researchers had studied over 100 YouTube videos, only 2 of them showed misinformation. So a lot of the tech companies have made efforts to stop misinformation being spread. But it doesn't mean that people can comment below these videos, even though companies really made an effort to stop false claims. You can't control how people, or you can, but maybe they haven't decided to do that yet. So that is also an issue to be more studied, the comment sections and closed groups on social media platforms. And we only find one study that mentioned autism and COVID-19 vaccines. That did not seem to be a big issue in the studies we found. But I mean, there could be studies now that have found this link, but we found one study where that was mentioned, that COVID-19 vaccine will make you autistic. And we discussed, this is just some assumptions. Maybe this would have played out differently if the COVID-19 vaccines were offered to young children. We don't know, but it's kind of, if you look at MMR vaccines and yes. There are some limitations and also some suggestions for future research. Do not include gray literature or preprints in our review. And also, a lot of the studies had a low quality of evidence and a high risk of bias, which of course is not desirable. But also the tools we used, or to phrase it differently, we included so many different designs in our study. So which makes it also quite tricky to assess because, yeah. And also we did not check for social media bots, which are automated accounts, which of course is a big thing when discussing social media platforms. And also that Twitter was overrepresentative in the studies we found, because Twitter has a specific population and it doesn't perhaps represent the very young who uses TikTok more, or even the quite older people. So that's definitely a limitation. Okay, so the conclusion of our study was that there is a need of more robust and experimental studies in order to assess the effect of misinformation on social media platforms. That was what the risk of bias and quality of evidence assessments showed us. And there's definitely a lack of studies from the global south, because most of the studies were from the global north. And in order to understand such a complex issues as vaccine hesitancy, we definitely need cultural and historical awareness to be taken into consideration. There's no use in just blatantly mock people who are vaccine hesitant, just rather try to understand what's going on. Yes, so these are the references for this presentation. And if you want to contact me, there's my email address. So thank you for listening.